Good day. My name is Adisha Gordon, and welcome to Lifestyle Medicine. This research project is geared towards increasing the competency of our residents in lifestyle medicine, with the hopes that lifestyle modification would be prescribed more often in the office setting. So sit back, relax, and let's begin. In this PowerPoint presentation, we'll go over the definition of lifestyle medicine. Then we'll touch on the six core pillars on which lifestyle medicine stands. This will be followed by a brief background of lifestyle medicine. Then we'll go into research questions, followed by questions for the patients. And lastly, we'll give resources for lifestyle medicine. The summarized definition of lifestyle medicine is a specialty that uses therapeutic lifestyle modifications or changes as the primary treatment for chronic conditions. Lifestyle medicine can be used to treat a variety of chronic conditions. This includes type 2 diabetes, cardiovascular diseases, and obesity. Now, there are six principles by which lifestyle medicine stands by. They are also known as the six core pillars. The first pillar addresses the importance of a plant predominant or plant based diet. The second principle or core pillar highlights the importance of exercise and physical activity. The third pillar then speaks to having restful sleep. The fourth pillar then addresses stress management. The fifth pillar then encourages avoidance of toxic substances or any risky substance to the body, such as recreational drugs or excessive alcohol. And lastly, the sixth pillar addresses the importance of having positive social connections. As a brief background of lifestyle medicine, it has been proven time and time again to reduce overall mortality and even change the trajectory of many chronic diseases. According to the Healthy People 2020 initiative, which can be found on the CDC under the Division of Heart Disease and Stroke Prevention, the six core pillars of lifestyle medicine is actually used as the basis of this agenda. Unfortunately, many office visits today comprises of prescribing medications and ensuring that patients are compliant. However, many physicians often fail to prescribe lifestyle modification even though it is proven to reduce overall mortality. About 6% of physicians reported that they recommend lifestyle modifications or prescribe lifestyle modifications to more than 50% of their patients. That would mean that about 94% of physicians either underprescribe lifestyle modifications or don't prescribe it at all. Another fact was that about 36% of obese patients, only 36%, reported that lifestyle modifications were recommended to them, even though obesity is known as a major risk factor for many chronic diseases. Lifestyle modification is just as important as medicine, as it has been proven to not only reduce overall mortality, but even change the trajectory of chronic diseases. So, even in patients who may have underlying diseases, lifestyle modification should be recommended.
Hey everyone, my name's Kyle. I'm one of the researchers involved in this study. I want to briefly talk to you about the research surrounding lifestyle medicine. And my main take home point is that there's extensive research in all six pillars of lifestyle medicine. Not only is there data supporting the effectiveness of lifestyle medicine, but also on its underuse in the primary care setting and its underuse in residency training. And this lack of training is one of the main reasons why we created this study. I recommend that you visit the ACLM website and go to their research section where you will find this page, which contains links to research involving the various topics shown. As you can see, there's research involving a wide spectrum of medical diseases and specialties, anywhere from obesity to chronic kidney disease and even longevity and quality of life. You can review these pages and get a sense of what type of evidence there is for specific aspects of lifestyle medicine. Now, as a future cardiologist, I would be remiss not to include something about cardiovascular risk reduction. I realize this is a dense slide, but I wanted to demonstrate that a great deal of research done by ACLM is done at the molecular and biochemical level, looking at trimethyl N oxide, or TMAO, which is a metabolite of the gut microbiota. It has been shown to be a predictor of incident CVD events, independent of conventional risk factors. It's been shown to predict major cardiac events such as MI, stroke, and death. And a related metabolite, trimethylamine, has also been shown to predict atherosclerotic burden and extent of CAD. And drawing your attention to the last line, similar prognostic utility of TMAO has been demonstrated in individuals with diabetes, PAD, and CHF. And these findings have been validated in 2 systemic reviews and meta-analyses. Again, this is getting very detailed, but I think it was important to demonstrate the level at which the research is done by ACLM. The Complete Health Improvement Plan was a study that was performed in Canada, and it examined the effect of short-term lifestyle interventions on various metrics such as BMI and blood pressure. Now, they only looked at a 30-day period, but as you can see on the slide, they found significant reductions in these metrics. Now, I think we all know that lifestyle changes can have an impact on a person's health, but ACLM, their journal, and studies like these back up these thoughts with detailed and specific evidence, which I think is important to take into consideration when you're thinking about lifestyle medicine and how you want to apply it in the clinic. So, thank you for listening, and thank you for participating in our project.
Hey guys, Charles Vallejo here. Just want to thank you guys again for listening up to this point. So again, I kind of just wanted to go over our research project. What is it and what are we going to be doing? So let me reiterate, this is a grant funded by the American College of Lifestyle Medicine. Okay, this is FAU IRB approved. And we're proud to say that we're the first residents to get Baptist Health IRB approval. Now keep in mind, this is a clinical trial, okay? Now, research. Couple questions we're going to be asking our patients here is, can we increase physicians utilizing lifestyle medicine assessment tools? Now, what does that mean? So we're going to be increasing the physician-patient lifestyle medicine discussions to improve the quality of patient encounters by increasing active patient participation in care. Right? We got to be asking ourselves, can we assess patients' readiness to change and subsequently engage patients to pursue healthy lifestyle habits? Now, I'm going to kind of go through this in the next slide a little in more detail, but we kind of want you guys asking these patients a variety of questions, kind of use this as a tool through the interview process. Now, we're going to have on top of these questions that we're going to go through next, we're going to have about 6 posters in each clinic, okay? You're going to have 4 posters in English, 1 in Spanish, 1 in Portuguese. So please try to utilize these, show them to your patients, kind of review it with them in their preferred language, okay? Aside from this, we're also going to have countless flyers at your disposal. We're going to have flyers in English and in Spanish. So please try to use as many of these flyers as possible. Try to distribute them in the beginning of the interview or towards the end, however you feel fit. And we really, really want you guys to kind of use these as a tool for the lifestyle medicine project, okay? So a couple questions we kind of want you guys asking our patients is, first and foremost, do you follow a healthy diet? Now, on the flyers we're going to hand out, we kind of have examples of what a healthy diet is. So, make sure they're not eating too many processed foods, that they're eating fruits and vegetables, they're getting their grains in, their proteins. Try to have them staying away from saturated fats, so less butter, more olive oil. Try to promote that, okay? Ask them if they're exercising 3 to 5 days per week. Okay, a lot of these patients may not be doing so. And when you do ask them if they exercise, ask them for how long. Sometimes patients might think that a simple walk around the block is enough. No, they should actually be exerting themselves for at least 45 minutes to an hour, okay? Do you limit or avoid alcohol intake? Remember, for women, should not be drinking more than 1 to 2 drinks per day. Men, 2 to 3. And even then, we really don't want them drinking alcohol excessively, okay? Please don't forget to go through this. On the topic of alcohol, tobacco as well. Definitely don't want our patients smoking. If they are, try to discuss options for them to quit. Utilize this. We have various tools at their disposal, okay? Do you avoid illicit substances? Sometimes we forget to ask this question, but very important in this day and age. Please ask your patients if they've used illicit substances and refer to them to help as needed, okay? Do you get 7 to 8 hours of sleep per night? Again, we should be encouraging healthy sleep. Make sure they're getting 7 to 8 hours of sleep per night and that the sleep isn't interrupted. And if they have problems sleeping, address why that is, okay? Ask them how do they cope with stress? What do they like to do on their time off to cope with stress? Ask them if they like gardening. Do they like to walk around the park? Do they like to cook? Okay, kind of just gauge what they do and give them healthy options and tips on how they should be avoiding stress, okay, and how to deal with stress. And ask them if they're satisfied with their overall level of health. Are they happy in their current weight? Are they happy in the trajectory of their comorbid conditions? If they're diabetics, are they happy with the current lifestyle habits that they have going on now? Okay, so these are all questions that I know we have to go through it now. You guys should be going through this anyways on your regular checkups. So please make sure this is discussed with your patients. Okay.
Hi, my name is Kushinga. So when I came to Florida Atlantic University to start my residency, I realized that there was a knowledge gap with regards to lifestyle medicine. And that desire to close that gap is kind of where this project arose. So over the 3 years as a resident, I was very fortunate to get the support from our program director and the staff to pursue board certification in lifestyle medicine and to be able to introduce the concept to our residency program. And a lot of the work that I've done really wouldn't have been successful without the help of Kyle, whom you've already met. Over the years, Kyle and I have been very fortunate enough to get the grant. We've also attended the national conferences and received scholarships along with publications in the Journal for the American College of Lifestyle Medicine. I'm also very excited that I am not the only resident who is board certified in lifestyle medicine. Last year, Dr. Joseph Salami also got his certification through a national scholarship from the American College of Lifestyle Medicine. I think what excites me the most is just how receptive the residents have been to lifestyle medicine and incorporating preventive care into their clinical encounters. I've shared some of the resources with a lot of the residents who have received microgrants. On the right side of the screen, you'll see Kat, who is now a PalmCrit Fellow. She applied for a microgrant and was able to educate some of the residents on the benefits of lifestyle medicine with regards to respiratory diseases. Other lifestyle medicine champions include Dr. Zadisha Gordon, who is the lead resident for this research project. She also received national scholarships to attend the National Lifestyle Medicine Conference, along with submitting abstracts and publications as well to the National Lifestyle Medicine Journal. We also have other residents who received microgrants. On the right, we have Paulina. She's now a GI fellow. When she was a resident, she got a microgrant and was able to educate some of the residents on the benefits of plant-based diets and gut health. We also have 2 other residents who are interested in the GI fellowship who pursued microgrants to talk about the benefits of a lifestyle medicine practice and the GIT system. Tanu, who's now a PGY2, and Oscar, who is a chief resident at Aventura. As much as we appreciate your support in us completing this project, I think our biggest desire is that all of you include lifestyle medicine conversations in all of your clinical encounters, because lifestyle medicine and preventive care is applicable to all systems. One of the greatest joys that I have is knowing that the concept of lifestyle medicine is going to continue to grow at Florida Atlantic University. This summer, the College of Medicine is going to officially open their lifestyle medicine interest group, which is a student-led body that is going to have access to more resources and is going to be initiating many programs that are going to benefit our Boca Raton community. I hope that you will all support them and that many of you will continue to inquire and explore the options of pursuing lifestyle medicine as well as your internal medicine career. Thank you.
All right, guys. So here's 5 steps for a healthy lifestyle. So make sure that these patients are active for at least 30 minutes a day or more. Okay, and ideally, as I said before, it shouldn't just be a walk around the park. They should actually be actively exerting themselves, whether that be swimming, a light jog, lifting weights, whatever it may be. Okay, choosing water as a drink. 8 glasses per day is preferred. They should be avoiding excessive caffeine intake, all these processed juices and sweetened drinks. Let's go with the water, okay? Try to promote drinking more water, eating more fruits and vegetables, okay? The more fiber in a diet, the better off you are. Okay, so please try to encourage the usage of more fruits and vegetables, and even try to come up with a couple recipes for them if they have issues eating certain vegetables, okay? Eat fewer snacks and look for healthier alternatives. Okay, so again, stay away from that processed foods. Try to go for more organic and natural options. And turn off the TV or computer and gadgets and get more active. I know it's the electronic age now, but please try to encourage your patients to get out there, be active, and get some fresh air, okay? All right, guys. So remember, the greatest wealth is health. An interesting quote I heard once from the Dalai Lama is that humans are interesting creatures. We like to sacrifice our health for our wealth throughout our life. And at the end of our life, when we need it most, we sacrifice all of our wealth for our health. So, we have to be on top of our health from the get go. It's important and essential that we're the healthiest versions of ourselves at all times, okay?
Congratulations on making it to the end of this presentation. I hope that it is the beginning of more awareness and consideration to prescribe lifestyle changes or modifications when prescribing pharmaceuticals for patients. To reiterate, lifestyle changes or modifications are just as beneficial as pharmaceutical medications, as it has proven to have all cause reduction in mortality and also change the trajectory of chronic diseases for better. Below is a list of resources in guidance in lifestyle medicine and prescribing lifestyle changes to patients. Thanks again for your listening ears and do enjoy the rest of your day. Bye for now.